It was one of those days that you never really forget.
I had a page that the helicopter had arrived and that they needed help.
It's very rare that we get a call like that, very rare.
She was awake but not alert.
I'm feeling her wrist. Somebody else is looking at the monitor. We realize that she's lost her pulse. And at that time, she went into full cardiac arrest.
I jumped up on the gurney and started doing compressions.
We started ventilating her through a mask and a bag.
Down through the kind of walkways you need to get to the elevators to get down to the ICU.
Probably had to have compressed her chest 500 to 1,000 times at least in that short amount of time.
Hey, we're in. This is for breath sounds. We got ears.
Somebody do a pulse check.
As we entered the room, I would say there was an easy 15 people, if not more, continuing the resuscitation process in the PICU.
Stats are 84. Breath sounds are good.
In the middle of the night, Davis, his leg had swollen to twice the size that it was before.
It's late part of the next morning, and as they're taking the x-rays, I can see that Davis is changing. He just started to become basically lifeless.
My first response when I walked into the room was actually to have a code called.
What's going through my mind is that he has a rapidly progressive infection, which may be life-threatening.
He's unresponsive.
I remember walking in and seeing Davis and somebody cutting his shirt very quickly.
We actually intubated Davis right there in the room.
Got good air movement.
I knew that he needed to get to the operating room quickly, at the very least, to save his leg.
I'm not screaming, I'm not crying, I'm numb.
We are actually running down to the OR because we can see the infection as it's traveling up his body.
I was starting mentally to try to prepare myself for the conversation that you have with a parent when they get to the hospital and the patient has already died.
Once I got to the hospital, my boss met me down in the emergency room, and first thing I asked her is if Lindsay was alive, and she said yes.
It was probably one of the most unstable situations that one could imagine.
Everyone trying to do everything we can to keep her alive.
Her blood pressure was terribly low. Her ventilation was bad.
Blood welling up out of her breathing tube.
Toxic shock syndrome, everything shuts down.
I really thought that she was going to end up dying of refractory shock from an infection.
And I made eye contact with Dr. Steinhorn, and he looked at me and he said, "Bring the family back."
And we all put our hands on Lindsay and just told her how much we loved her and she had to keep fighting.
You can't leave us yet.
Stay with us, stay with us. And then they asked them to leave so that they could continue.
The most concerning thing that was going through my mind is, could I find what was causing this horrendous infection?
We released some of the pressure in his foot and leg.
I had previously seen one other patient who had had a similar presentation, and the source was actually in his abdomen.
So when we opened his abdomen,
we immediately noticed that the muscles that were lining the left side of his back were obviously dead. The source of his infection and the source of all of the pressures in his left leg are originating in this dead muscle.
She said he's alive and that it's very, very, very serious.
It was unlike anything I'd ever seen before. He was blue and his abdominal contents were exposed.
I was very concerned that he would not even survive the next few hours.
When you resuscitate children, there has to be a threshold at which you say, there's nothing else we can do. And we were getting to that point.
Keep compressions going.
I saw him working on her, and he looked up at the clock, then looked at us, and I said, "Don't stop, don't you stop."
We recognized at that point that there were not good breath sounds of air exchange on the left side of her chest.
I quickly scrubbed down her chest and
very rapidly made an incision in the chest wall.
Just entered her chest and the air came out.
And after that point, things actually started to stabilize.
Every time I'd lay down in the waiting room, I'd wake up and look out the window, and across the street there was a church, and see the steeple. At that time, I really thought that, she was going to make it.
I don't know if he was actually getting better, but he wasn't getting worse. And that first night, I was never so happy to have that sun come up. And it still happened.